Hello and good morning. Today our topic is seizure and epilepsy. Seizures are temporary disruptions of brain function caused by an uncontrolled excessive neuronal activity. Basically, that activity is not in our hands and it occurs uncontrolled and is very sensitive. And it has two types. One is temporary and second is chronic recurrent seizures. And in the temporary seizures, they have seen that there's acute electrolyte disorders, hypoglycemia, kidney functions, meningitis, and drugs. Okay, and in recurrent seizures, which are chronic, for example, epilepsy, it causes a trauma, tumor, infection, degenerative changes, hereditary, and its mechanism is the imbalance between the inhibitory and excitatory transmission. For example, if there is an excitatory transmission, there is no inhibition to stop it. And then there is an imbalance and an epilepsy is caused. There are two major types. There are focal partial seizures or generalized seizures. They are limited to part of cerebral hemisphere, and generalized seizure involve both cerebral hemisphere diffusely. It is the focal or partial seizures remain in one part, and in generalized seizures they involve the both cerebral hemispheres. Okay, in focal partial epileptic seizures, in the beginning there is a small localized region of the cerebral cortex, and its causes can be a scar tissue, a tumor, a destroyed area, a deranged local circuit, and it is further classified into Jacksonian epilepsy and psychomotor seizure. What is Jacksonian epilepsy? It progresses as muscle contractions throughout the opposite side of the body, and it shows a short period of amnesia, an attack of abnormal rage, sudden anxiety, discomfort or fear, and a movement of incoherent speech. And in generalized seizures, there are diffuse, excessive, and uncontrolled neuronal discharges that spread to both cerebral hemispheres. There are two types: generalized tonic-clonic seizures, known as grand mal epilepsy, or absent seizures or petit mal seizures. Okay, in grand mal seizures, they are, as you know by name suggesting grand, there is a sudden loss of consciousness, extreme neuronal discharge from all areas of the brain, and tonic-clonic seizures, meaning the seizures are cloning, happening in rapid fire again and again. The patient bites his tongue and may have difficulty breathing, which will cause cyanosis, and due to loss of sphincter control, he may urinate and defecate. And the seizure may last for a few seconds to 3 to 4 minutes, and it is followed by post-seizure depression of the entire nervous system, because there is the depletion of the dopamine in the nerve cells, and person remains fatigued and sleeps for several hours after the attack. In the EEG, which is done of the brain, during tonic seizures, there is a high frequency and high voltage brain waves. This is a epileptic EEG, and in generalized tonic-clonic seizures, which we just talked about, this is a high frequency and high voltage. As you can see, there is 100 microvolt, and in absent seizures there is a 50 microvolt, and with a compared to comparatively low frequency than the generalized seizure, And then there's the psychomotor, the lowest voltage and the lowest frequency. And EEG stands for electroencephalogram. Okay, and then there are the precipitating factors in genetically predisposed persons, or if there has been trauma to the brain before. And the factors which cause epilepsy are strong emotional stimuli, alkalosis, drugs, fevers, loud noise, and flashing lights. How the attack can be stopped? It will stop by itself when the person is fatigued, his dopamine is finished, and you can also cause active inhibition of the nerves. Okay, so we will discuss the second epilepsy, which is the petit mal epilepsy, and it goes on for 3 to 30 seconds and doesn't go for minutes. And there's a twitch-like contraction of muscles in the head region, especially blinking of eyes. And it is followed by return of consciousness and resumption of previous activities. The attack may occur once a month or after many months, and it also starts in the late childhood and then disappear at the age of 30. It may initiate a grand mal attack, and EEG shows spike and dome pattern. Okay, so in the treatment of epilepsy, there is a medical, and then there is the surgical approach. The surgical excision of the epileptic foci can often prevent seizures. They are present in the brain. And then we come to the psychotic behavior and psychosis. Psychosis is a severe mental disorder in which the thought processes and emotions are impaired and the contact with reality is lost. There are different types of psychosis. Number one is depression, then there's mania, then there is bipolar, and then there's the schizophrenia. In the depression and manic depressive psychosis, it results from a diminished function of neurons that secrete a specific neurotransmitter, and then there is a decreased formation of norepinephrine and serotonin in the brain, and they provide drive to the limbic areas to increase a person's feeling of well-being. A person feels good actually, and in dementia, psychosis results from there is, for example, there's less neurotransmitters, meaning norepinephrine or serotonin. Basically, they are feel-good hormones which are lessened in psychosis. Okay, and those neurons that secrete it are also making less and less of that neurotransmitters, and they provide well-being of a person. If there's too much norepinephrine and serotonin secreted, the person is in mania, he becomes mad and is extremely happy. And patients often alternate between depression and mania. His treatment is the inhibitors, which produce inhibitors of the neurons, which produce the neurotransmitters, and tricyclic antidepressants, for example, Prozac. And now we will come to schizophrenia. In this, the patient suffers auditory and visual hallucinations, fear and delusions, and paranoia. Paranoia means extreme fear for something. Delusion means he is seeing things. And hallucination is also the same thing. And the sense of persecution, incoherent speech, he cannot speak well, and he cannot think well, and the posture is abnormal, and it is due to excessive dopamine production and blockade of neural signals and abnormal function of the hippocampus. Dementias, diseases and conditions characterized by a decline in thinking, language, behavior, and memory to the extent that a person's ability to perform daily activities is affected. For example, Alzheimer's. For example, in dementia, in Alzheimer's, a person cannot think, cannot remember the language, his behavior is changed, and he cannot perform daily life activities because he often forget things that what he has to do or what he has done. There are types of dementia. Alzheimer disease is a type of dementia. Okay, and it is the premature aging of the brain. The brain gets old. There's amnesia, deterioration of language, visual special defects. And then there's the motor and sensory defect, gait disturbance, and the seizures are seen in the late stages of this disease. Loss of neurons controlling memory in the limbic system. The beta amyloid plaques accumulate in the brain of these people. Okay, thank you very much for listening. Hope you find it useful. Goodbye. Please like, share, and subscribe.